Hamilton's Medical Officer of Health, Dr. Elizabeth Richardson, joins us this morning to talk about vaccination efforts in the city. Good to see you again.
Good morning. Good to see you.
Has Hamilton reached its vaccination goals?
So we're not quite there yet. We're at 76% of adults over the age of 18 that have had their first shot, and we're very happy about that, of course, but we really want to get to 80% of the population having had their first shot, 75% having had both shots across the board in the city. And we know some parts of the city are a little further behind, and we want to make sure that everybody is able to get their vaccine and be well protected.
Because those numbers were set out as kind of that's the way to herd immunity almost, right?
That's right. Herd immunity is what's really important when we're fighting this virus. We know with the Delta virus, it's actually having both shots that gets you that immunity, and those immunity levels need to be high, probably going up closer to 85%. And so over time, we want to see those numbers continue to rise.
Okay, so how is the city then working to make sure that people who haven't even got one shot yet, that they can get it? Because a lot of people, I know we heard early on in the campaign, I can't get out of my apartment, I can't get out of my home. How are we doing that?
So there are all sorts of things that are going on. And I was just talking with my primary care family medicine colleagues yesterday, and we're talking about the month of outreach. And so everybody within the healthcare system, all of the Hamilton healthcare partners, they're making it as easy as possible for people to get their first or second doses of vaccine. And keep in mind too, we'd really like people who are still having to get their second shot, if it's been more than those 28 days, please rebook your clinic appointment if you'd like, or just walk in and come and get that second shot, because we do want those second shots to be moved up to protect people against this Delta variant. But we have people who are reaching out to their clients through our primary care practices. We have people in public health, as well as all across our healthcare partners, asking everybody when they come in, have you had your shot? Is there information you need? Can I help you book a shot if that's better for you? Did you know the clinic across the street is open right now and you can get your shot? We have our vaccine ambassadors, of course, working with community groups across our city to help people get into the clinics and answer any questions they have. Transportation is available for people. They just have to call our vaccine hotline, hit option 7, and they can get transportation to help them to get to a vaccine appointment. So there are all sorts of ways that we're out there doing it. And of course, this new move this week with every one of our clinics being walk-in clinics is a key part of that, whether it's first or second dose.
I'm glad you mentioned questions, because we have a number of viewer questions that people are asking. Let's talk about a lot of questions come in about why is the vaccine making me so tired, or why did the second shot hit me so hard?
Well, the good news is about those reactions is that is great evidence of your body reacting to that vaccine, building up its immunity, your immune system doing what it should so it is ready if that virus does present itself. We can't stop people from being exposed to the virus. It is still circulating out there. And what this vaccine does is get your body ready to fight it. And so that's very good evidence that that's what's happening.
Another question asked, and actually quite a few have asked, about mixing vaccines. Will I be able to travel? I know this isn't a Hamilton-centric question. It's a world question, right? Because some facilities are not accepting certain mixed vaccines.
That's right. And we're going through that phase as vaccines have been developed. And, this is not just a local thing, as you said. This isn't a provincial thing. This isn't just a Canada thing. This is a global thing. And so there's a lot of people, a lot of groups that have to work out what the vaccine policies are going to be. So we know here in Canada, absolutely mixing vaccines is accepted. It is fine. They've worked out the policy things. Now they're working out those policy issues on a global stage. And so those will get worked through. Ultimately, we'll see what the policy is that's produced. We're not there yet, but I have every faith they're going to work through it in a very good manner.
Have a number of questions as well about booster shots. One particularly, does the efficacy of the vaccines, does it lessen with the more variants that come out?
Well, the variants, what viruses do is they continue to evolve to try and figure out how to stay alive and how to spread. And so that is the nature of what a virus does. Now, it changes in ways that could continue to be susceptible to the vaccine working, or in ways that might make it so the vaccine's not quite as good for them. And so that's what researchers are continuing to monitor. Surveillance systems are monitoring across the globe. We don't know if a new variant comes out, it may well be covered, as we've seen with previous variants, or there may be some changes in terms of the coverage. And that's why a booster dose is being considered as we go forward.
Okay, and if you haven't got your shot yet, please go get it. Dr. Elizabeth Richardson, Medical Officer of Health for Hamilton, thank you for joining us today.
Thanks so much, Annette.